Did you know that your skin, nails, or even the color of your tongue could reveal early signs of iron deficiency? Iron deficiency is the most common nutritional deficiency in the world, and it doesn't just make you tired, it can quietly affect your heart, your brain, your mood, and even your immune system. But here's the scary part. Most people don't realize they're low on iron until the symptoms become severe. That's why learning to recognize the visible clues your body gives you could make a huge difference. Today, you're going to learn 14 signs of iron deficiency you can actually see. By the end, you'll know exactly what to look for and when to talk to your doctor. Let's get started. Number 1, pale skin and mucous membranes. The first and most classic sign is paleness, especially in your face, lips, and the inside of your lower eyelids. Here's why. Iron is a key part of hemoglobin, the protein in red blood cells that gives your blood its red color. When iron levels drop, your blood literally becomes lighter and less oxygen-rich. That's why your skin, especially around your eyelids, gums, and palms, can look washed out or pale. Try this simple check. Stand near a mirror and gently pull down your lower eyelid. If the inside looks very pale instead of reddish pink, that's a red flag for low hemoglobin. This works across all skin tones. It's one of the easiest ways to spot anemia early. Number 2, shortness of breath and fatigue. Low iron means low oxygen, and oxygen is what fuels every muscle and organ in your body. So even mild anemia can leave you winded after climbing stairs or carrying groceries. You might notice your heart racing or feel lightheaded after standing up. That's your body trying to compensate. It's pumping blood faster to make up for the low oxygen. If simple activities suddenly feel harder, don't just brush it off as being out of shape. Your blood might be running low on iron. Number 3, spoon-shaped nails or Koilonychia. Now look closely at your fingernails. Are they thin, brittle, or shaped like little spoons, curving upward instead of down? That's Koilonychia or spoon nails. It happens when chronic iron deficiency weakens the nail structure. Here's a simple home test. Put a drop of water on your nail. If it pools in the middle instead of rolling off, that's a sign your nails are concave and possibly iron deficient. This symptom takes time to develop, so by the time it appears, your iron levels have usually been low for quite a while. Number 4, cravings for ice, dirt, or non-food items, or Pica. One of the strangest signs of iron deficiency is Pica, craving things that aren't food. The most common, chewing ice. People with low iron often feel an almost uncontrollable urge to crunch on ice cubes, starch, clay, or even chalk. Doctors don't fully understand why, but it may temporarily increase alertness in people with anemia. If you or someone you know can't stop chewing ice, that's not just a quirk, it's a powerful clue that the body is low on iron. Number 5, smooth or shiny tongue, or atrophic glossitis. Stick out your tongue in the mirror. Does it look smooth, shiny, or sore? That's atrophic glossitis, and it's a classic sign of iron deficiency. Normally, your tongue is covered with small bumps called papillae. When iron is low, your tongue loses those bumps because it can't regenerate tissue fast enough. That can cause a burning feeling, soreness, or even make food taste different. So if your tongue looks unusually smooth or polished, that's a sign your body is struggling to make new cells. Number 6, cracked corners of the mouth or angular cheilitis. If you've ever had painful cracks or sores at the corners of your mouth, you know how uncomfortable it can be. This condition, called angular cheilitis, is often linked to iron deficiency. The skin at the corners of your mouth is delicate and constantly moving. When iron is low, it becomes weaker and slower to heal. That allows bacteria and fungi to infect the tiny cracks. If those corners are always sore or split, even when you're using lip balm, it's time to check your iron levels. Number 7, frequent infections or slow healing. Iron plays a key role in your immune system. Your white blood cells actually need iron to fight off bacteria and fungi. When you're iron deficient, your immune cells lose their ability to attack invaders effectively. That means more frequent colds, skin infections, or fungal issues like athlete's foot or ringworm. If you find yourself getting sick more often or cuts that take forever to heal, your immune defenses might be running on empty because of low iron.
8, restless legs at night. Ever lie in bed and feel like you just can't keep your legs still? That creepy, crawly, uncomfortable urge to move them could be restless leg syndrome, and iron deficiency is one of the biggest causes. Iron is essential for producing dopamine, the neurotransmitter that controls movement in your brain. When iron levels drop, dopamine production falls, and your nerves start firing irregularly, leading to that constant twitching or tingling. Even if your iron tests come back normal, you can still have low iron in the brain. So if you struggle with restless legs, it's worth discussing iron supplementation with your doctor. 9. Hair thinning and hair loss. Your hair follicles are some of the fastest growing cells in your body, and they need a constant oxygen supply to stay active. When you're low on iron, your body prioritizes vital organs like your heart and brain over your hair. The result? Hair thinning and shedding. You might notice more hair in the shower drain, or a widening part line. If that's happening alongside fatigue or pale skin, low iron might be the missing link. 10. Itchy or dry skin. This one often surprises people. Iron deficiency can cause your skin to feel dry, flaky, or itchy, even without a visible rash. That's because reduced blood flow and oxygen delivery cause skin cells to regenerate more slowly. Your nerves also become more sensitive, which can make the itch worse. If you're constantly scratching or your skin feels unusually dry despite using lotion, check your iron status. 11. Dark circles under the eyes. While dark circles can have many causes, lack of sleep, genetics, dehydration, iron deficiency is one that often gets overlooked. When your skin becomes paler, the veins under your eyes show through more clearly, giving that dark or bluish tint. So if your under eye area suddenly looks darker or more sunken, it could be a visual cue that your hemoglobin is low. Once your iron levels recover, many people notice those dark circles start to fade. 12. Dizziness, headaches, or brain fog. Your brain uses about 20% of your body's oxygen supply. So when your blood can't carry enough oxygen because of low iron, your brain feels it immediately. That can cause dizziness, headaches, poor concentration, or a sense of brain fog. You might struggle to focus or feel unusually irritable. Low iron also affects the production of serotonin and dopamine, the chemicals that regulate your mood. That's why iron deficiency can mimic depression or anxiety. So if you've been feeling mentally foggy or emotionally drained, it's worth checking whether low iron is part of the picture. 13. Increased heart rate or chest comfort. As your iron levels drop, your body has to work harder to deliver oxygen. Your heart compensates by beating faster, sometimes irregularly. In mild cases, you might just notice a stronger heartbeat or mild palpitations. In more severe cases, you can actually develop an enlarged heart or even heart failure over time. So if your pulse feels unusually fast or you experience shortness of breath with minor activity, don't ignore it. It's your body's alarm system telling you it's struggling to circulate oxygen. 14. Red or pink urine after eating beets. Here's a weird but fascinating one. If your urine turns red after eating beets, it might reveal something about your iron levels. Normally, your body breaks down a pigment in beets called betalain before it leaves your system. But people with low iron often can't fully break it down, so it passes through into the urine, turning it red or pink. This is called beeturia. Only about 10% of healthy people experience it, but up to 80% of people with iron deficiency do. So if beet juice makes your urine look like fruit punch, it could be your body sending you a signal. If you recognize several of these signs in yourself, don't panic, but do take action. Ask your doctor for a simple blood test. It's quick, inexpensive, and could reveal exactly what your body needs. And remember, fatigue, pale skin, or brittle nails aren't just cosmetic issues. They're clues. Your body is communicating with you. If you found this video helpful, hit the like button. It helps this channel reach more people who might not realize their symptoms are connected. And if you want more videos that help you understand what your body is trying to tell you, subscribe and turn on notifications. Because the more you know, the better you can take care of yourself. Stay curious, stay healthy, and I'll see you in the next video.